Once the diagnosis of twin-twin transfusion syndrome has been made, you and your provider will be further discussing different management options. Not all treatments and therapies are an option for every woman and their babies. Therefore, reviewing your specific pregnancy diagnosis is an important first step in working towards finding a therapy to try to optimize your pregnancy outcome. Unfortunately, if twin-twin transfusion syndrome develops in the second trimester and expectant management is pursued where no treatment is performed, more than 90% of these pregnancies will result in loss of either one or both of the twins, with a surviving co-twin having long-term neurologic complications. Thus, several treatment options exist, including amniotic septostomy, serial amnio reduction, and fetoscopic laser therapy. Historically, amniotic septostomy was an available option to treat twin-twin transfusion syndrome. This involved creating a hole in the dividing membrane between the two fetuses. This allowed the fluid to flow between the two sacs and to ideally equalize. This, however, did not address the underlying abnormal placental vessel connections and has not been shown to improve outcomes. Additionally, creating a hole in the membrane creates a monoamniotic gestation where the babies are in the same sac, and this creates the associated complications of cord entanglement that are unique to monoamniotic gestations. This is no longer a recommended method of treatment. Amnio reduction involves removing excess fluid from the recipient twin's sac. In the past, this was standard therapy. This treatment relieves the pressure caused by the excess fluid in the recipient's sac. Because of the reaccumulation of the excess fluid, this procedure has a high likelihood of needing to be performed numerous times. Similarly to amniotic septostomy, this does not necessarily treat the underlying process in the placental connections. Survival of at least one twin will occur in approximately 50% of severe twin-twin transfusion cases treated with amnio reduction. In approximately 25% of these cases, both twins will survive, and in another 25%, only one survives. Clinical trials support that the best treatment of twin-twin transfusion syndrome is fetoscopic laser therapy, performed between 16 and 26 weeks gestation. With laser therapy, you are brought to the operating suite where both you and your babies are monitored and kept comfortable throughout the duration of the procedure. The procedure involves placing a fetoscope into the recipient twin's amniotic sac. Subsequently, placental mapping is performed where a detailed evaluation of the placenta, including the number and location of the connecting vessels, is noted. The laser fiber is then used to ablate these connections. At completion of the laser, excess fluid is removed from the recipient twin's sac, normalizing the amniotic fluid. Laser has been shown to result in better overall outcomes, with more babies surviving. There's approximately a 70% chance of survival of one fetus and a 50% chance of survival of both fetuses with laser therapy. Additionally, laser therapy results in pregnancies delivering later in gestation. A final documented benefit of laser includes the lower incidence of long-term neurologic consequences, particularly when compared with amnio reduction.